Hi, welcome to this presentation on eCareAgora, a solution suite for entire healthcare ecosystem. I am Mujita, Director of Long-Term Infotech Group. Our long-term vision is a healthcare platform which connects all stakeholders in the healthcare ecosystem. This platform will have analytics at its core and will facilitate B2B transactions among the providers in order to fulfill seamless and integrated B2C services to citizens. We will start with the big picture of eCareAgora. We have three main pillars in this solution suite: consumer health, which is targeted for all citizens; B2B trade and projects, targeted for healthcare and wellness businesses; and discovery platform, targeted for both businesses and consumers. Consumer health. Personal risk factors. Won't it be nice to receive personalized recommendations on health programs and diagnosis checks? Personalized consumer health is our differentiator. For this purpose, we need to maintain and track personal risk factors. These include risk factors across various categories as mentioned here. A sample of chronic risk is covered here. We will glance through other categories in the demo. Coming to routine tests, have you ever thought you and your family need to be informed on the routine tests and diagnosis checks? We support recommended screenings across all age categories as mentioned here. This is a sample recommended screening for young adults. All tests mentioned here are a mandate for an young adult. These include tuberculosis, diabetes, HIV, high cholesterol, hepatitis B, breast cancer, cervical cancer. Based on last test date and a recommended frequency, next due date for a particular condition will be calculated. A risk level indicator for this condition is also computed from personal risk factors. People can also take a risk assessment for this disease. Complications which can arise for this condition is also available. All these serve as demand creation mechanisms for these tests, fulfilling evidence based preventive care. Coming to risk assessments, have you ever felt the need to have a preliminary online risk assessment before approaching your provider for the diagnosis tests? This is also a booster for evidence based preventive care. It helps overcome the stigma associated with various preventive checks like I don't have diabetes, why should I bother about this test? Based on age, gender, ethnicity, a series of questions, risk level for an individual for a specific condition is assessed. A sample questionnaire for diabetes is shown here. Once a person takes up this questionnaire, a risk factor matrix is generated, and this risk matrix for diabetes is mentioned here. Various risk factors include overweight, obesity, ethnicity, abdominal obesity, physical inactivity, and various disease conditions include pre-diabetes, type 1 juvenile diabetes, type 2 diabetes, gestational diabetes, etc. Indicators against signs and symptoms are also presented here, and all these serve as a strong proof to take up diagnosis checks. Coming to program and provider discovery, for health programs, the ecosystem consists of providers like governments, device pharma biotech organizations, wellness providers, medical care providers, health research firms, public health organizations, and these are various categories of programs. And these programs are organized in high impact places, otherwise, and also in clinics, hospitals, camps, and at home. Program organizers, clinicians, and allied health providers facilitate rolling out these programs to various citizen groups. These health programs are across many categories. A sample program, kidney disorder screening camp, is noted here. A summary of the program is shown. And assess the risk option is there for assessment of risk level for an individual for kidney disease. And based on the risk level, people can take informed decision on whether to attend the program. The appointment option provides contact details for the program. And various filter options are indicated here. Coming to provider discovery, provider ecosystem consists of providers across 10 plus categories as shown here. And we need to search for these providers based on location, service needed. eCareAgora facilitates this kind of provider discovery. Coming to B2B platform for trade and commerce, these are sample trade which can occur between healthcare businesses. Research equipment devices, medical devices equipments, medicines, drugs, raw materials, finished goods, consumable supplies, samples, infrastructure support, and IT hardware. Coming to freelancing projects, any business or individual can post or take up online freelancing projects. This is a fast emerging area mainly due to the interdisciplinary and multidisciplinary resources required for various healthcare projects and collaborations. Sample projects between healthcare businesses and individuals are noted here. Coming to partnerships, short term or project based partnerships and long term or strategic partnerships between healthcare businesses is very popular these days. This platform facilitates easy discovery for partnerships across all these categories. And all these features depend on a full-fledged repository of secure citizen risk factors, program repository, and provider repository. Thank you.